Ahí vamos. Tú mira. Tú ves, eso es lo que yo hago, que le tiro entonces el screenshot. Ahí le tiro el screenshot. Oh, este es de 2 horas. A patient care technician is assisting a patient to perform a possible range of motion exercise with the following action. Should the technician take, pursue the patient back at the low head, introduce the patient to flexible, place the patient in high fluid position, move the patient arm. Esta no me dice si está buena o está mala. Oíste.
Y eso estoy viendo.
Which of the following provide a specific definition about scoring patient for... Pero le voy a tirar la screenshot como quiera, ¿verdad?
Exacto. Tírale el screenshot para saber la pregunta.
Which of the following provided is especially defining about scope of patient for patient care technician? The hair insurance, yo veo esto como borroso. Let me see.
No,
A
está
ver,
bien.
atención. The discrimination. Tú lo estás leyendo también, ¿verdad?
Sí, ajá, que dice scope practice.
The following provided specific defining about scope patient. I don't know, patient technician. ¿Cuál tú crees que es?
Which of the following provides a specific definition about the scope of practice for patient care technician? Yo creo que la D, la C.
La sé.
Te dame un segundo. The patient self-determination act. No.
The training of informant center. I don't know. Vamos a dejarla ahí, pero yo no sé. A patient care technician. Tú ves, esa yo no la había visto. A patient care technician is caring for a patient who is to receive, continue to feeding. The technician should place the patient into which of the following position? Central, dorsal, secure. Me imagino que es supine.
No.
No,
Bueno,
supine no.
supine está en el piso. Prom está abajo, dorso, semifalos. La A.
Semifalo. No, semifalo como curviado.
No, semifalo es así, like,
Como entre, como sentado.
Sentado.
Ajá. Oops. So two patient care technicians are transferring a
Mira, le tiraste un screenshot, highlighten, tiene que tener cuenta, quita el mouse.
Okay.
Ok, tírale el screenshot de nuevo.
Okay. The two patient care technicians are transferring a patient who is discreet from a bed to a morgue gurney. To avoid injury, the technician should use which of the following body machine? Roll the patient gently from the bed to the, no. Use a draw sheet, patient, no. Have one technician lift the head, then other lift the feet, allow the movement to move the patient, no. Use a machine lift with a sliding to move the body. Esa es verdad, un lift.
Yo creo que era la C.
Qué mierda.
¿Por qué se sigue poniendo eso? Se le está dando solo a la ventana.
Lo que tiene que darle dos a la misma vez. A patient care technician is about to perform a vena punch for a patient, which of the following equipment should the technician use to prevent hemolysis to the blood sample? A small volume tube with 21 gauge butterfly needle, a large volume tube with 23 gauge butterfly needle, a large volume with 25. So, mientras más chiquita es, mientras el número es más grande, más chiquita la aguja.
La B.
So a patient care technician is about to perform a vena punch for a patient. Which of the following equipment should the technician use to prevent hemolysis? La 23.
A
Porque
large,
la 23, porque si muy chiquita va a chocar.
por eso yo digo que la 23, porque la 23 es el size que mayormente utilizamos, pero la
Yes.
21 es más, aún más.
Es más chiquita, recuerda, no, es mediana.
Y está diciendo smaller volume.
Yeah. Okay.
Mira, la está dando el screenshot con la highlighting, remember.
Okay. Which of the following can reduce a normal mark on EKG tracing that are caused by patient movement or muscular tremor? Speed control, calibration, artifact field, which of the following can reduce a normal marker on EKG tracing that are caused by patient movement or muscular tremor? Calibration no es, el speed no creo, y el gen no es. So yo creo que la C, artifact filter.
Yo creo que la A.
Speed control.
Porque dije, which of the following can reduce abnormal marks on EKG tracing that caused by patient movement or muscular. ¿Cuál tú crees era? Yo creo que
Artifact
la B.
calibration, ¿verdad?
Ujú.
Vámonos con la B entonces. Oops. What am I doing?
A patient care technician.
Okay. A patient care technician in a facility sustain a needle stick injury. Which of the following should the technician notify following the incident? The nurse, the National Institute for Career Safety, the patient, the center of the seat, the nurse, a la persona que está ahí que tiene que decirle, ¿verdad? A la que está encargada. Qué mierda. Esto me desespera, sí. They hit it? I'm not sure.
A patient care technician should identify.
¿La tiro? Okay.
Sí. Tírala.
A patient care
La tiraste,
technician.
Jay.
Yo creo que sí. A patient.
¿Estás segura?
Sí, yo creo que sí.
Tírala,
Sí.
tírala, si no estás segura.
La tiré ahí. Okay. A patient care technician should identify that a bed scale should be used for a patient who have with of the following condition: fractured ankle, above the knee amputation, total hip dislocation, menopause, estacio úlcera. Ok. Me imagino que la persona que está amputado, que tiene about the knee amputation.
Es la C, yo creo.
¿Tú dices que la sé?
Dislocation.
También esa gente no se puede mover tampoco.
Es porque dice toro.
The patient care technician should identify, yeah, the best scale should be used for patient. Esa está tricky, ¿oíste?
No, porque estoy diciendo que la cama, está en la cama que no se puede mover.
Sí, pero una persona que tiene que tiene hasta las rodillas, está amputado hasta las rodillas también. Déjame, ok. Dice, a patient, y no me puedo parar entonces, porque este me tiene una hora realmente, 2 horas. A patient care technician is lifting box from a care into a patient room. Which of the following actions should the technician take to ensure proper body machine? Hold the box closer to the body, maintain a narrow base of support, bend of the grid to pick up the box, twist up the torso when turning to pick up the box. No. Bend.
Patient care technician is lifting box from the car into the patient's room. Which of the following actions should the technician take to
Yo
ensure
creo,
proper body
yo,
technician?
yo creo que la A, hold the box close to the body. Es
No.
verdad. ¿Cuál te ves? Lifting
Oh,
box.
yeah. Hold the box close to the body, pero le está faltando bend the knee.
Yeah, ajá, bend the knee, pero no está ahí te dice twist the body. Tú no vas a twist.
No.
Ok, le di continuo. Vamos a ver.
¿Cómo
A
es?
ver.
¿Cuál es la tecla que tú tienes que dar para...?
Yo le estoy dando window y después le estoy dando al press X,
Ya,
SC.
ya, ok, ya.
Tú le estás tirando también para tenerla.
No, 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 sino que quería saber.
Ok, a
Era el
patient care,
window, ¿no? ¿Verdad?
sí, window y esa.
Ok.
A patient care technician received a needle injury during a routine vena punch. Which of the following actions should the technician take first? Report the incident to the supervisor? No. See a provided for evaluation? No. Wash the site with anti-microbic
Ujú.
soap? Get
Ya.
this test? No. Wash. You have to
Wash,
watch.
wash, wash.
Esto hace lo que yo pierda más tiempo de esta manera. Tú le deberías tirar foto también por si la moco.
Todo estoy haciendo, pero empecé tarde. Come on, sigue.
Pero está bien. A patient care technician is applying sequentially compression this
Device.
device SCD to a patient who is postoperativo. The technician should identify the SSDS are used to reduce the risk for which of the following condition? Edema, deep vein thrombocyte, varicose vein, pneumonia. The patient care technician is applying sequential compression device no sé, to a patient who is protoperative. Que tienen como, que ya estaba como operado, ¿verdad? Protoperative
Creo
detention.
que tal vez la B, la C, digo.
Sí, very
Porque dice
good.
sequential compression device.
Neumonía no puede ser.
La
Ed-
C, la C.
Edema no es. Solo
Dale la
hace.
C,
Bueno,
la C.
okay. A patient care technician is caring for a patient who have vision loss. Which of the following actions should the technician take when assisting the patient with meal? Offer to feed the patient, call off uh, cut off solid food into the small pieces while waiting of liquid until after the patient have finished eating. Now describe the location of the food and then try using the fate of the class as the reference. So,
Sí, B.
la D. Yo creo que para
A,
mí
B.
está la D y la offering to feed in the patient.
No, para mí la B.
La D.
A, B,
Cup,
la segunda. Cut all solid food into small pieces.
yo creo que la D. Describe the location of the food on the tray using the fake class of. Yo me voy con la D.
Oh, la D, no leí la D. Describe the location food to the tray using the face of the club or the reference.
Yes. Sí, porque una persona ciega.
Oh, because have the vision. No leí esa
Yeah.
parte.
No
Yep.
leíste esa.
No.
Era la D.
¿Qué pasó? Porque la pantalla está oscura.
No sé. Déjame chequear de un pronto a ver si se está, because, es verdad. Ok. Esta es la
Okay.
16. Ok. Vamos por la pregunta. Este es el
Derecho.
screenshot.
Lo que pasa es que tú tiraste varias de la misma.
Sí, está bien, no, está bien. Yo que.
Tiene la pregunta marcada, despégala.
Ajá. A patient care technician should identify that the provider with staff and as exquisite screen test if a patient develop which of the following symptoms. Okay, a patient care technician should identify that the provider will stop and SSI screen
Exercise stress
test.
test. If the
Es un
patient
stress test.
develops, which of the following symptoms?
Syncope.
Yep.
Yep, syncope. Solamente si se marea que sí que paran el stress test. Okay. A patient care technician is preparing to perform a venipuncture for a patient. The patient is stay. I am pretty anxious about this sign. It's my first time having a blood draw. Which of the following actions should the technician take? Explain the reason the provider prescribed the test in detail. Inform the patient about all
La
possible
D.
complications. Preparing an ammonia, no. Describe the procedure to the patient, yep. Tú ves, este examen es diferente, ¿oíste? Nada del primero que ella nos dio. Por eso es que estamos tan jodidas, ¿oíste? Porque
No, pero
no
que
sabe, ella,
esto no es que esto es flapar, esto es.
Amelia, pero yo acabo de leer el que ella me dio y solamente está eso.
Ok.
Está
Continúa, que
el
se acaba
primero.
el tiempo. Vamos a ver si
A,
lo acabamos.
a patient care technician is preparing to document information in a patient electronic health record, EER. Which of the following action should the technician plan to take? Record care before it's provided? No. No, a patient responsive to a analogous. Record the patient vital sign reported by the nurse. Use general phase when document. General phase? I don't get it. A patient care technician is preparing to document information in a patient electronic health record. Okay. Which of the following actions should the technician plan to take? Record care before it's provided? No. No patient respond to the
No.
analogy? No. Record the patient vital sign as
Yeah.
reported by the
Este.
nurse. Esa.
Ujú.
Tú tienes que record y después decírselo a la enfermera.
Yes.
Which of the following procedure instead for a finger stick should should a patient care technician do first? Clean the side with an antiseptic wipe, of course. Select the appropriate part of the third or fourth finger. Position the blade of the lancet across the line, no, of the finger. Confirm the correct identification of the patient. Esa. Lo
Yeah,
primero,
that's
confirmar
the
la
first thing.
confirmación. Yeah.
Y después limpia el site.
Yep. No, después lo consigue el site. Después consigue que tú vas a hacer y después lo limpia. A patient care technician is assisting a patient who is postoperative with deep breathing exercise. The technician should recognize that the exercise can be prescribed for which of the following reason. To treat respiration area, to prevent respiration complication. Esa yo la sé. Esa ten las otras.
You should always read all of them
I
because you
know.
never know if it's right or wrong.
I'm reading.
Or si había
Continúa.
I had 2 hours to do the test. Not like
2
the
hours. It
yeah.
says 1 hour.
Now it's 1 hour.
The pause time is only 5
A
minutes.
patient
Patient care
care
technician should identify that
to
which of the following patient
the
requires droplet
by
precaution.
prescription.
A patient who
A
has
patient
influenza, a patient
influenza,
who has
a
scabies, a patient who has pediculosis, a patient who has hepatitis A.
Mira, que tu papá. A patient have hepatitis.
La D.
Yo creo que la cual
La D.
scabby.
No
¿Qué
la
fue?
D. La que
Okay.
tiene hepatitis.
No, pero es hepatitis A. Yo creo que scabby. Patient who have scabby.
¿Qué es scabies?
Ese es como algo como rabia. Influenza no, puede ser influenza. ¿So cuál tú crees que es? A coger cualquiera.
Yo creo que pues, tiene que ser entonces la C, porque la C me parece como que si fuese algo, alguien que tiene tuberculosis, algo que puede ser contagioso, es, ¿no es verdad?
Nos fuimos con eso entonces.
Yo no sé.
Yo no sé. A patient care technician is caring for a patient who have a anatomy. The technician should expect the fecal material to be more solid and less irritating to the skin if the stomach is placed in which of the following location: in the ileum, in the essence, in incendio colon, in the semicolon, in the secure. Esa está tricky. La pregunta está al revés. Yo creo que es la D. En el índice. Yo creo que la C. Me fui con la C. I don't know. Esas no están en el coso que yo cogía. No. A patient care technician is preparing to obtain and process a original drug test for a patient. Which of the following actions should the technician plan to take? See the patient leave with the label from the chain of custodial form. Check the specimen temperature with 10 minutes of receiving the specimen. Ship the specimen to the testing laboratory the next day. No, introduce a patient to the flush to the toilet following voting.
Creo que la A, pero déjame leer la pregunta. A patient care technician is preparing to obtain a process urine drug test for a patient. It's processed already. Which of the following actions? So, ya el orinó. So,
El orina. So, yo
seal
creo que
the
la A.
specimen. Yeah, it's A.
Ujú. Okay, a patient care technician is transporting a patient using a wheelchair. Which of the following actions should the technician take? Ensure the patient feet are placed on the foot strap, yes. Footrest, place a loose blanket over the patient left, no. Fasten the seatbelt loosen around the patient wrist, no. Put the weight, put the back wheel into the crossfair when going, no, la primera. Segura que el paciente tenga los pies encaramados antes de comenzar a correr. Yeah. A patient care technician is teaching a newly hired technique about precaution endoscopy, gastrotomy, wow, PEG, tube. Which of the following statements should the technician make? PG tube are easy to disposable than nasogastric tube. Patients who are disorient or confused are less likely to dissolve the tube. Patients who are receiving enteral nutrition via a PEG tube have an increased risk for aspiration. If a patient requires enteral nutrition for more than 2 weeks, a nation tube should be used. So, a patient care technician is teaching a new higher technique about precaution. Okay, PEG tube. Which of the following statements should the technician make? ¿Cuál tú crees?
Porque la palabra precutaneous, ok, precutaneous endoscopy gastro tube. So, es que le dan comida por un tubo, por el estómago, ok? That's what that means.
Yo creo que esta
So,
tiene
okay, the
más chance
patients
de
who are receiving enteral nutrition via PG tube have increased risk for.
Yo creo que esa tiene risk for expiration.
Yeah, that's the one, porque ese que que tiene alimento, ¿sabes? Estás recibiendo alimento por ahí. Tú sigue dándole ese botón.
A patient care technician is caring for a patient who have a two-piece colostomy system in place. Which of the following actions should the
Colostomy
colostomy
system in
should
place.
the technician take when providing a colostomy care? Apply pressure for 30
Ajá,
seconds.
cuando provided what? Providing ostomy,
Ostomy care.
stomach care.
Ostomy care. Esos son de la gente que lo tienen los tubos en los dos lados, la barriga, que te sacan el intestino. A patient care for 30 seconds when applying the skin very wet. Where
La C.
cut the skin very wafer to be allowing the stomach. Verify that the stomach is more than dress pink in color. No. Cleanse the skin around the stomach with hot soap and water.
Es la C.
Pues, está diciendo para limpiarlo, porque es para
No,
tu limpiar.
patient care technician is caring for a patient who has two-piece of colostomy system in place. Which of the following actions should the technician take when providing stomach care?
Tiene que limpiárselo, cleanse the skin around the stomach with hot water and soapy water.
En soap and water. Entonces, según la clase, luego, if you see, no, not that one.
¿Cuál es?
Es la D.
La D, ¿verdad?
Ya la
Yeah.
D. Entonces, pero no viste.
Oh,
Entonces lo que sigue es la C. La C.
la C. Which of the following is the proposal of using a standard precaution in the hair care setting to ensure that all hair care workers receive the necessary immunization to protect staff and patients from airborne illness to agglutine the patient understand infection control guidelines before signing information control to reduce the transmission of bloodborne pathogens when providing care. Which of the following is the proposal
La
using a
D.
standard precaution? La D.
So, el otro es, ¿sabes por qué era la C? Porque después que tú lo limpias, if you see que la piel está roja, rosada o negra, you have to report it right away porque el paciente tiene una infección severa.
Yeah, a patient care technician is caring for a patient who have a cerebrovascular accident and is non-ambulatory. Which of the following findings should the technician report to the nurse immediately? A skin decoloration that suicide with reposition, chronic loss of feeding in one extremity, one episode of incontinence, change in size and shape of pressure ulcer.
Yo no me sé
Maybe
esa, pero yo pondría la B.
la B. A chronic loss of feeding, no, a feeling
Feeling.
in one extremity. Oh, yeah. Que
Yo
no está,
pondría esa.
yep, yep, que no está sintiendo en un lado.
¿Cuál
A
tú
patient
pondrías? ¿Tú pondrías esa misma?
¿eh?
¿Tú pusiste esa misma?
Sí, yo puse esa. A patient care technician should identify the adjusting a patient bed to the to
To
be
be between
between
60
15
and
and
90.
90. We place the patient in which of the following position. Let me see. 90 es bien parado. So 60. Yo creo que es semi-flow, ¿es
Yeah,
verdad?
that's the one. Semi-follow.
Semi-follow. Porque aquí está todavía. Puede ser esa o
Continúa,
como.
corre que el tiempo.
A patient care technician is caring for a patient who is to undergoing a blood transfusion. The technician should recognize that which of the following vital signs should be reported to the nurse immediately. Respiratory rate 17, blood pressure on under 80/9, no. Pulse rate 80, temperature, la temperatura está en 101.
So tiene un blood transfusion, okay?
Yep,
The
yep,
signature
la
should recognize
temperatura.
that which of the following
El pulso está
vital
bien.
signs should be
El blood pressure
reported.
está bien. La respiración.
Respiration is to be from 12 to 7 to 20. It's
To
good.
20, tú ves. Entonces la fiebre. Okay, which of the following device should a patient care technician use to help a patient maintaining balance with being weight on a scale? Walker, elevation bar, can, balance bar. Yo creo que un can, de verdad. O un walker. No, porque
Yeah,
está teniendo.
which of the
No,
following device should a patient care technician use to
yeah,
help a patient maintain balance, Anna? Balance.
yeah, esto, el balance
Yeah,
bar.
that's what I'm at.
Yeah, el
Por
balance
eso fue
bars.
que te lo leí de nuevo.
Yeah, el balance bars. Yeah.
Yeah. Mhm.
Yo después dije, no, espérate, que está diciendo que lo va a pesar. Si pone un walker, va a pesar el walker también. A
Yeah.
patient care technician is assistant with the
Physical.
physical examination of a patient. Which of the following identification should the technician use to verify the patient identifying age, date of birth, room number, and diagnosis? Date of birth.
Yeah, date of birth. Date of birth.
Ah,
Nada más son dos teclitas y a mí no me está dando eso.
maybe yo no sé, no lo presté a la misma vez. A
Quita eso
patient
de
care
ahí. Todavía está
a
al aire.
¿A dónde
Quítalo.
no está highlight?
¿Está en la parte de arriba?
No, mira aquí.
Ok, ahora se quitó.
A patient care technician is preparing to perform an ordinary cataract care for a female patient. Which of the following actions should the technician plan to take? Place the patient supine with thin sliding adduction. Use a normal saline to cleanse the mixture. No. Cleanse around the mixture with the antiseptic solution. No. Take the cleansed cataract nully to the lower lid.
Creo que entre la A y la D, déjame leer. A patient care technician is providing is preparing to perform urinary cathetering.
Yo creo
Ok.
que adoption, yo creo que la A.
Es la A, porque
La A, porque tú la
de
tienes que
catheter.
abrir. Y ahí está catheter, tú la tienes que abrir.
Yeah.
Te digo a ti.
Hizo Ana, I don't know. Ana, nada más window y aquello dos juntos en that's it. You don't need to.
Eso que estoy haciendo.
No.
A patient care technician is caring for a patient who is unable to boil his bladder and is carrying in pain. His attending provided have not yet made round, and his primary nurse is unavailable. Which of the following actions should the technician take? Immediately insert a strained catheter to abolish the patient pain. No. Report the patient pain to the charging nurse. Yes. Ask another nurse for permission to catheter. No. Contact the patient on provided. No. Report to the PIN and the charging nurse, ¿verdad? Amelia.
Ajá, estoy aquí.
Okay. Tuve esta la voy a bajar aquí y le voy a hacer aquí porque para que la pueda tirar entera, ¿verdad?
Claro, no se veía.
Which of the following remia is present in the tracing below? Okay, aquí tiene stop, so dice
Lo puedes
elevator.
subir el volumen,
Ahora
simplemente súbelo para arriba. There you are. Quita eso del lado.
ectopic
Quita eso del lado.
ectopic arteria tachycardia.
Quita que tengo que salir el screenshot. Ok, thank you.
Atrium premature contraction, atrial fibrillation. No, yo creo que ectopic atrial tachycardia. No es one-the-long pacemaker. ¿Cuál tú crees que es? Yo creo que ectopic.
¿Por qué tú crees que es topic?
Porque está bien elevado y el heart rate también está acoso. Hay una taquicardia y aquí tiene parada.
Yep, that's a topic, yep.
Yo diciendo que es topic. ¿Tú ves?
Okay. Como tú digas, tú estás cliqueando todos los botones.
No, solamente le estoy dando a dos. Lo que pasa es que por una razón no van los dos juntos. A patient care technician is caring for a patient who have an state prescription cancer. The patient family expressed concern because the patient have refused admission to the hospital program and is seeking additional medical treatment. Which of the following actions should the technician take? Encourage the patient to enter the hospital program. Tell the patient that further treatment is not on option. Acknowledging the family counsel and notify the nurse. Recommend alternative treatment option for the patient. No. Acknowledge the family consent and notify the nurse. Es verdad.
Yeah.
Porque tú no puedes asustar, ¿verdad? Tú no puedes estar en for tampoco de patient. Si él no quiere, ¿verdad?
Yep.
1, 2, 3. Okay. A patient care technician is planning care for a patient who is on contract precaution. When entering the patient room, the technician should apply which of the following? To B. A patient care technician enters in a patient room and is approached by visitor question, task resolved. Which of the following response by the technician is appropriate? The doctor need to give you the information, the label, volume, will of waiting, the specimen, reference range. I'm sorry, but I can't give you the information. As I asked the nurse to give you the information. Hola.
Sí, but the patient care, okay, yeah.
Ya, que preguntarle a la nurse es la única que puede dar la información, si no el doctor. A patient care technician is caring for a patient following the application of a immobility spine. Which of the following actions should the technician take to ensure the patient safe? Lower the bed side rail, raise the bed to the technician work height, ensure that the spine remain smooth, place the cold light with the patient reach for the patient safe. So lower the bed side rail, no. Raise the bed, technician work high, ensure that the spine remain moist. Place the cold light, me imagino que el cold light, porque es para patient safe.
Sí, pero está, he's caring for him.
A patient care technician is caring for a patient following the application of a immobility spine. Which of the following actions should the technician take to ensure the patient safety? ¿Tú ves?
Exacto, la seguridad del paciente.
Entonces me imagino que esta, ponerle la cola y cuando termina. Porque es la seguridad del paciente. O esa, o ensure that the spine remain moisture. No, yo creo que esa.
Yo pondría, era la A.
Load the bed side rail. No, ese ponerle, bajarle el side rail. Yo me fui con la D.
Yeah, let's go.
A patient care technician is caring for a patient who is 24-hour post-operative following a TAPI hip arthroplasty, o le hicieron el hip, que tiene una operación en el hip, and have a surgical wound. Which of the following findings should the technician identify as a indication of potential wound infection? Serration, disgrading, general discomfort of the incision site, oral temperature, no. Increased warm around the inside side.
Yeah, eso significa infección.
Esa, ¿verdad?
Yeah, infection.
A patient care technician is asked by a nurse to complete a task that is outside his scope of practice. O sea, scoop es como que está fuera de su, ¿verdad?
Ana, quita el mouse en la letra, porque si tenemos que hacer algo, vamos a tener problemas.
Ok, así.
Ajá.
Um,
Ajá,
a,
sí.
a scoop after discussing his concern with the nurse and in failing to come to the resolution. The technician should report his concern with other following individual. The attendant provider, the charging nurse, the cancer managing nurse, another patient care, the case manager, ¿verdad? Porque está hablando de la nurse, la no le que le está diciendo. So me imagino que esta.
No, porque tú estás dando un complaint
Por eso mismo.
y te está diciendo que te salga fuera de tu scope of practice.
Y ahí es la nurse que le está diciendo eso. So
Ajá,
tiene que,
a quién tú le vas a reportarlo? A la
a la,
nurse.
no a la nurse, a la supervisora.
Exacto, ya.
Entonces ahí decía nurse y decía después de supervisor, algo así.
Ok.
No decía supervisor, decía la otra. A patient care technician is measuring a adult patient blood pressure, electronic, which of the following reading should be reported to the nurse. Siento decir, eso es normal, 130 o 81 está bien. 110.
That's high also.
Esta, la 98 sobre 60,
Esa es la
that's
mía
low.
cada rato.
Yeah,
La que yo
that's low.
reportaría es la de.
Esta,
Yeah.
ok. Bueno, es que casi no, muy poca gente tiene presión. A patient care technician is document a patient intake and out. Which of the following measurements should the technician include when recording output for the end of the shift total? As a second fluff on the one present, natural susu volume, solid stuff for a colostomy, total preparation, nutrition, and administration. Patient intake and out. So de lo que come y lo que saca.
Exacto. La
Cereal,
D.
la de verdad, total patient in nutrition
Mhm.
administration. So
Yeah, that one.
patient care technician is assisting with the care of a patient who have diabetes. Yo tengo que buscar esa palabrita que no, todavía no se me queda. Military. The technician should, military, ¿qué es eso? The technician should know that which of the following is a sign of hyperglycemia. Color, clammy skin, fever, frequent urine, repeat, showing, and
La
respiration.
D.
Rape, swallow, show respiration. No, pero tiene diabetes. A patient care technician is assisting with the care of patient who has diabetes. Wait a minute. The technician should know which of the following is the sign of hyperglycemia. Yo creo que esto,
Yo creo que es
color,
la A, porque
yo
color
creo que,
clammy skin.
yes, it's clammy skin. Wait. A patient care technician is caring for a patient who have right side heart failure, heart failure. Which of the following findings should the technician expect? hypertension, tachycardia, swallow in the lid. Yo creo que es swallow in the lid.
Estaba buscando la palabra melatonin.
A patient care technician over here in North State that say to a patient who have cognitive in impairment, I'm so tired of you riding the cowbell. The technician should identify that the nurse action violation, which are the following part of the patient bill right. The right to be free of physiology of no, the right to be free for physical abuse, no, the right of food treatment, the right to discuss about plan of care. Es verdad eso,
Mhm.
porque tiene derecho también de su care.
You have the right to refuse any care.
A patient care technician is preparing a patient for hospital discharge. The patient is stated, I am afraid to go back home to my apartment. Which of the following response by the technician is appropriate? Would you like to speak with a police officer? No. If you partner is abused, you are home. Will you tell me immediately? No. Your partner love you and you have no reason to be afraid. Can you tell me if something happened that might you feel or
La
sad?
D.
Es
Mhm.
que tiene que ver que si el marido está ahí, que si le dan cosas. A patient care technician should identify that which of the following patient require contact precaution. A patient who have
Contact precaution.
a rotavirus, a patient who have a tuberculosis, a patient who have, nope, hello, tuberculosis.
Tuberculosis.
A
Okay,
patient,
pero,
yeah, a patient care technician teach their glove will trade their glove with cleaning a solid matrix and get some of the cleaning solution on their hand. After cleaning their hand, which other following action should the technician take next? Seek medical attention, file a work compensation claim, review the safety data sheet for the cleaning solution, submit a report to the Occupation Safety and Health Administration. Yo creo que esa la de.
yeah.
Tú tienes que hacer un reporte.
Mhm.
So a patient care technician is caring for a patient who has copper and he's receiving oxygen therapy. The technician knows that the patient appear restless and is short of breath. Which of the following action should the technician take? Increase the fluid of oxygen to the patient, notify the nurse immediately, assist the patient to ambulate, lower the head of the bed. No,
Notify the nurse.
no.
Lo va a matar si hace eso.
Si hace algo más, lo va a matar, tiene que de una vez llamar porque no sabe lo que está haciendo.
No, pero si hace cualquiera de las opciones que estaba ahí, lo mata.
Yeah, a patient care technician is performing a EKG for a patient who have a pacemaker. Which of the following control should be adjusted to ensure a accurate EKG tracing? Lead selection, artifact fire, heart rate limiting, speed. LSP, es verdad.
Mm. ¿Cuál es la
A heart rate limiting on. Artifact filter, no creo. Porque tiene un pacemaker. Y al igual que con el pacemaker va más rápido.
To adjust the EKG. Ujú.
Ya, el SPI, ¿verdad?
El
Ya
espía
te
de la
just,
máquina,
por eso mismo.
pero él tiene un coso, el espía está en la, no está en la, esto es la máquina. Él tiene un
Él tiene,
pacemaker.
él tiene un pacemaker. So, ¿cuál tú crees que es?
Está bien.
No, mira. Mira. Dice heart rate limited. No, tú no vas a poder
No,
hacer el heart rate.
no.
Artifact filter. Leave selection. No puedes seleccionarlo. Los se quedan igualitos. So, yo digo que el SPI.
Okay.
A patient care technician is caring for a patient who is non-verbal. The technician should identify that which of the following finding can identify the patient is experiencing pain. Describe the temperature, the redness, change in level of consequence, dry skin. Yo creo que la decrease temperature. Yo creo que es a redness,
Restlessness, yeah. That patient
yeah,
is in pain.
yeah, redness, que le da como, tiene como rojo, colorante, ¿verdad?
No, eso no es, eso es restless cuando que no quiere descansar.
Oh. A patient
En
care
quieto.
technician is caring for a patient and notice a fire in the waster basket. Which of the following actions should the technician take first? Close off door to the patient room, remove the patient from the room, activate the emergency alarm, extinguish the first. You had to remove the patient. Eso es lo primero que tienen que hacer, ¿verdad? A patient care technician is
Delivery de
caring
coche, yeah.
for a patient and notice a fire in the waster basket. Which of the following actions should the technician take first? Remove patient from the room. And then remove the patient from the room, close all the door, and activate the alarm. I put remove the patient from the room. Porque, ¿qué tú harías primero?
Yes, you know, you extinguish, remove the patient from the room. Yeah.
Yeah. A patient care technician is performing perinatal care for a patient who is at risk for skin breakdown. Which of the following products should the technician use to prevent skin breaking? Very creaming, slightly superfluous creaming, moisturized creaming, premature, moisturize.
Mhm.
Porque cada cosa. Patient care technician is performing a EKG for a pediatric patient. In which of the following locations should the technician place lip BC? On the arterioaxillary line, on the maxilla line, half between lips or no, on the four intercostal space, left interval. No, so let's say aquí, está la axilla line. Yo creo que esta, ¿cuál tú crees que es?
La A.
Axila, ¿verdad? Anterior axila.
Mhm.
No, porque es la 6.
La C. Anterior significa el frente. No, no
Ya,
puede ser eso.
esta. That maxilla line.
Mhm.
Ya. Ay, no, yo todavía con la cosa de EKG todavía estoy. A patient care
La que
technician
es
is,
posterior.
yeah. A patient care clinician is preparing to discontinue a patient peripheral IV. The technician assembly of the need equipment and perform handling hygiene. Which of the following actions should the technician take next? Explain the procedure to the patient, remove any or overline tape, turn the IV roll sharply off, apply pressure to the side for 2-3 minutes. Explain the procedure.
Yep.
Aunque yo creo que tú deberías, antes de cualquier cosa, deberías el procedimiento, antes de tú comenzar a sembrar todo, ¿verdad?
Yep.
Digo yo. So, quizás no era eso, las cosas va a quedar así porque son.
Yep.
Which of the following organization provided
Tenemos poco
following
tiempo
for,
ya.
yeah, identify and prevent the spread of communication disease? OSHA? No,
La FDA.
FDA, creo. Oh, bueno.
Okay. Oh, let's pick one. Let's pick.
Okay, doesn't matter. A patient care clinician is preparing post-mortem care of a patient. Which of the following is a correct technique for preparing the body? Remove any detuning as soon as possible. Place the
Dile en tu
body.
mente, porque te está faltando poco tiempo, no te va a dar tiempo.
A patient care clinician is performing post-mortem care for a patient. Which of the following is correct technician for prayer? Place the food in towel to, I don't know. Ensure they all to.
Ya,
I
dale,
don't,
cualquiera.
I don't know.
Queremos agarrar toda la pregunta.
Yep.
Please stop hitting that button. You
A
lose
patient care technician is performing auto care for a patient. Which of the following findings should the technician report to the nurse? The stomach has a small amount of body draining. The stomach is red in color. The stomach is leaking around the waist. The stomach remain the same size. So the stomach leaking around the waist, yo creo. The stomach is red. Yo creo que
Yeah,
no.
esa es la que yo creo. Continue.
Yeah. 1, 2, 3. A patient care technician should identify which of the following reading should be reported to a nurse because indicate that a patient might become unresponsive. Sino taquicardia, ventricular taquicardia.
Ujú.
1, 2, 3. Sube. 1, 2, 3. Yo le doy hasta 3. A patient care technician is caring for a patient who is terminally ill. Which of the following should the technician take? Encourage the patient to remain attentive about their diagnosis, determine how to patient family is cope, evaluate patient mental health, inform the nurse the patient express
La C,
feeling
C.
of la C.
La C es la.
A patient care technician is performing a 12-lead EKG for a patient. Voy a coger cualquiera. Let me see.
No. Papers piano. 25.
Ajá, at 25. Qué mierda.
Ana, nada más tienes que darle presionar, coge el window y ese. Yo lo estoy haciendo lo mismo aquí y
A
no me está
patient
dando
care
ese
technician.
problema. La C.
Apply the guilt bell over the patient close of the week. A patient care technician should identify which of the following tasks require the use of strip glove, anti and waiting original draining bed. A patient care technician should identify that which of the following tasks required to use a straight glove, remove indolent urinary catheter, apply condom catheter, enters. I don't know. Patient care technician have assisted a patient into bed in which of the following location should the technician place a draining bag for a patient in the retaining on the floor, securing to the side rail, hanging from the IV, secure for the front of the. En la cama, ¿verdad?
Mírala.
La. Retaining in the floor.
Ujú.
Oh. Patient care technician in a long-term care facility is caring for a patient who require retraining, for which of the following reasons should the technician expect a preview to prescribe retraining to prevent patient from injury, descent of over, to prevent patient from feeling of I don't know, to allow patient integration of the content. Ponela. Yo lo que quiero es coger toda la pregunta. Okay.
Exacto. Bien.
A patient care technician is performing AKG and no me va a dar tiempo cogerla toda. Soy va. Oíste.
Ok.
Son 50 minutos y voy para 60. A nurse asks patient care technician to enter a patient of the back. The technician is unfamiliar with it. This take, which of the following should the technician take? Ask the introduction from the nurse before attending to take that. As another technician performing as to the questioners. A patient care technician is wearing gloves which assistant to insert a original catheter, which of the following part of chain of infection is the technician is of infection area. Patient care technician in a hospital setting is caring for a patient for a patient had terminal cancer and say, I need to live long enough to see my child get married. The technician should identify the patient and anger, asistencia, deny. Which of the following is the most important action a patient care technician can take to help prevent the spread of infection? Wearing personal protection equipment, performing hand hygiene
La B,
between
la B, la B.
Yep. When collecting a multi-drop bottle sample, which of the following sites should patient care technician attending to draw first? Medicula, hello, mediocubicula. Patient care technician is obtained a patient capital code.
Ana, tienes el coso, el screenshot puesto ahí todavía. Okay.
The technician should measure the pulse at which of the following location: the first intercostal space, the fifth intercostal space, the seventh intercostal space, the 10th, and the fifth intercostal space.
Yeah.
A patient care technician is asked to leave a patient medical record in a designing area for preview to view. Which of the following actions should the technician take for the happy? Check the record for accurate, obtain any mission signing or concept form, stay with the record until the provider arrive, ensure that
La
not
D.
the patient information visible.
Mouse,
Patient
mouse,
care, eh?
mouse.
Patient care technician is informant technique with a patient
Ahí
who
no,
have.
no va a dar. Sí, mira, son y 49.
Ok, yo voy a coger entonces cualquiera.
Ok, da mucha chance.
No, no va a dar. Es verdad.
Ya no.
Oh,
No
shit.
creo.
Espérate. ¿Dónde fue que me quedé? Ok.
Sí,
Ese le di, ¿verdad?
espera. Yo le estoy dando más rápido que tú. Que tú le sigues dando a ese botón de ahí arriba.
Es que pasa que a la misma vez que uno está grabando, uno está más lento, ¿me entiendes?
Sí.
Te digo a ti. Entonces, como yo estoy así como lento, como rápido, me pongo como nerviosa.
Te pone más lenta.
Sí.
Tú pones la mano a donde yo te estoy diciendo, no, no vas a cometer tantos errores. Que te sigue saliendo esa cuestión.
No te lo estás tirando con la contesta, no.
Eso no está dando ninguna contesta.
No, y para tú. Close.
Tú ves, eso yo te iba a decir, de que cuando nosotros nos cogíamos, yo creo que esa tiene que arreglarla.
Cuando uno coge una pregunta,
Súbele un chisma para arriba. Está muy pequeña.
ya.
Está muy pequeña, no importa que se borre lo de arriba. Un poquito más, un poquito más. Y lo que hace es que la sube. Ahora súbela para arriba. Sí, continúa.
You're so slow. Oh my God.
Dedo
Get
en
him.
Windows y el otro dedo a que no está usando las dos manos.
Yo estoy usando las dos manos. Por eso es. Mira, es que un, dos y tres.
Le está dando a Windows sola.
Voy a tener que darle primero al otro y después a Windows. Mira, como quiera.
No es que tienen que estar los dos juntos.
Yo estoy dando los dos juntos.
Primero le da eso y luego la selecciona.
Entonces, mira, ahí se puso eso. Sin yo darle. Vamos a ver si me da la respuesta después.
Yo quiera.
O si no me lo den en el otro examen. ¿Oíste?
Exacto.
En el examen que están arriba, más seguro.
Ujú. No, pero yo veo que es más rápido que yo le tome la foto.
De esta manera, como yo lo estoy haciendo, porque de la otra manera yo lo estoy haciendo más rápido.
Bueno,
¿Oíste?
¿qué otra manera?
Como tú me enseñaste primero.
Pero esta manera es mucho más rápida.
No,
Dame un
yo
chance.
que la otra.
Ya.
Ya yo que la otra para mí mejor. Cometo menos mistake.
No, con esta tú estás haciendo mejor. Esta es
No
mucho
cuenta yo,
más rápido.
cuenta yo hago más mistake. Mira que me sale el bendito win de la mierda. Yo odio tener tiempo.
Ah, me lo dice. Yo estoy sudando aquí.
No voy a chicharre en el.
Pues porque está con tiempo.
Yeah.
¿Es verdad?
Ajá, y no sé. Ah, pero es que son 120. Ay, yo pensaba que eran menos, pregunto. Pensaba
Por
que eran
eso.
100.
Ya.
Ya no. Y el otro yo lo voy a coger cuando tenga que coger, que
Cuando
no
ya te
tenga,
haya terminado todo, Ana.
ya, cuando no tenga que coger el screenshot, porque,
Pero es bueno saber.
ya, de todo han salido mucho que yo no he visto en el examen que yo estaba estudiando.
Pero es bueno que mejor nos quede tiempo para regresar para atrás y corregirla. Y que ya
Ujú,
tengamos la foto, ¿me entiendes?
sí. ¿Y en cuál nos quedamos? ¿Tú tuviste más o menos la página? La
Eh,
hoja.
estábamos bien por las 50,
No, por la 63 creo yo que era.
por ahí más o menos. Que tuvimos que salir corriendo.
Ya, era como por la 60 y algo. Porque tú sabes que yo estoy pensando que son menos.
Y que yo que estoy viendo el tiempo y yo estoy aquí frustrada.
Que le dio
¿Qué
a eso.
hiciste?
No sé, no, yo,
Lo tienes allá, aquella cuestión. Ok, dale,
esto.
no le dé finalizar, no le dé finalizar, no. Dale review. Ya. Ok, usemos nuestro tiempo and then go back to the 20. Debiste de usar el flag,
¿Cuál?
y te voy a mandar
Esto.
una vez. Ajá.
No hace nada.
No, porque eso da flag da la pregunta. Go.
Oh, dale. Ok, ya, gacho. ¿No te hicimos esa?
No,
No, no.
coge. Se nos acaba el tiempo revisándola. Ok.
Ah, esa era, ¿verdad? Esa.
Dale.
Ya. Ya, yo creo que era esa. Ah, no, pensé.
No, era donde se estaba muriendo, ¿verdad?
Anti-training origin. Esa era, ahí era.
Ya, ajá, déjala ahí.
Patient care technician should identify which of the following as required use the sterilized gloves, empty a individually original draining bag, injecting a intermittent original catheter, applying condom, removing an injury. No, esa misma. A patient care technician have assisting a patient into bed. In which of the following locations should the technician place the draining bag? Oh, esa fue.
Ujú.
In the floor.
Ah, pues
So,
eso fue,
okay.
ajá.
En la 63. A patient care technician is in a long-term care facility, is caring for a patient who require retrain. For which of the following reasons should the technician expect a private, provide to prescribe retrain, to prevent patients from injuring themselves of other? Yo
Yeah,
creo que
está
esa,
bien.
¿verdad?
Yeah, good.
A patient care technician is performing an EKG and
Chest pain.
patient report chest pain and discomfort. Which of the following action should the technician take? Performing another EKG? No.
No.
Responsible the patient chest electro.
Notify the provider.
Notify the provider. A nurse asks a
Patient care
patient.
technicians to empty a patient's stomach bag. The technician is familiar with this tag. Which of the following actions should the technician take?
Ask the
No,
introduction from the nurse
another
before.
result.
No. Add the introduction from the nurse before attending the check. Yeah.
Yeah,
A patient care technician is
it's
wearing
wearing
gloves
gloves
with
while
assistant
assisting doing
to
insert
insert
unit catheter.
or
Which
unit
of the
catheter. Which of the following part of
chain
chain
of
of
infection
infection
is the technician
susceptible has
in
portal entry, infection, danger, yo creo que esa susceptible, pues.
O sea que a mí se me quedaron los anteojos por allá y pues yo no veo casi nada de lo que estoy leyendo.
A
No puedo.
patient care technician in a hospital setting is caring for a patient who have terminal cancer and say deny. Which of the following is the most important action a patient care technician can take to help prevent the spread of infection? Wearing personal protection equipment, performing hand hygienic between contact with the patient. Yep.
Yeah.
When collecting a multiple draw venous sample, which of the following sites should the medical? Yep. A patient care technician is obtained a patient at epitel post. The technician should measure. Yep.
From the face intercostal.
Yep. A patient care technician
La
is
Omar,
asked to leave
por favor.
uh, up to leave a patient medical record in a designated area for the preview to view. Which of the following actions should the technician take the area of HIPAA regulation? Check the record for the current, obtain any missing signature record, ensure no identification of patient information is visible. A patient care technician is reinforcing teaching which a patient who have a hosted monitor. Which of the following statements should the technician make? Remove the wallet at bedtime. Take two bad intention or shower. No. Avoid use the electro during monitor spend. Set the time of the digital clock at the beginning of the monitor period. Remove. Avoid use
La B, la
elect
B, la B. He cannot
to.
shower.
Yeah, he cannot.
Ah,
A patient care technician is preparing to obtain a 12-lead EKG for a patient who have a electro alarm amputated, arm amputated. In which of the following locations should the technician attend to left arm lead? The right on the amputated side, no. Anterior axilla line, left.
no, quita eso, eso no, on the right.
Yo creo que en the left, toro,
No, porque que la tiene, no, on the right.
and the right.
Porque él tiene una amputación on the left.
Yeah, but a patient care
Dame mi
technician is
gafa, por favor,
preparing
porque
for
no lo veo.
12-lead EKG. a patient who have left
No
arm
puedo poner.
amputated in which of the following location. Tú no puedes ponerlo, so tienes que ponerlo anterior. Yo creo que
La morada.
en the left.
Coge la que tú creas. Que estoy buscando mi gafa. Que no veo lo que estoy leyendo.
A patient care technician is caring for a 75 years old patient who have a meeting for a malnutrition. The patient family managing the finance and grocery shopping for the patient. Which of the following hospital department should the technician expect to enter this patient care? Dietary, foster care, social worker, occupation therapy, hereditary. A patient care technician is introduced to measure a patient pulse manual. Which other following should the technician take?
No,
Look at the
esa está
rate.
usando el thumb, no puede usar eso. Es 30 minutes. It's 1 minute.
30 seconds, 1 minute, ¿verdad? Look at rate,
Pero
alter,
está usando el thumb, no puede.
use the thumb. No. Located the rate field for the pulse with the inset and middle finger and the console pulse for a last
Yo creo que la
left
A.
left 1 minute. Pulse center the palm over the
Locate the radio arteria filling the pulse with the index, middle finger and control the pulse for 1 minute, yeah.
la A patient care
Yeah,
technician noted that the
the patient
patient cuts his foot without a bulletin and is bleeding. Which of the following should the technician take? Activate the emergency reporting, introduce the patient to remain in extended
La
position,
D,
place the after streaming below to do, apply straight pressure. No, apply a straight pressure to the wound.
la D.
Oh, yep. A patient care technician is preparing to obtain a 12-lead EKG for a patient who is being evaluated for chest pain in the emergency department. Which of the following actions should the technician take? The patient express fear of the produce. Avise the patient that the test is painless. Require the patient to remove of clothes. Inform the patient that resolve is not an option during the present symptom, causing the patient that jewelry near
Es
with
la A.
no,
Es
my
la A.
cause explic.
Lee lo que dice.
Tiene que quitar la jewelry y toda esa cosa, tiene
Pero
que
eso no
remover.
tiene que ver con la pregunta.
Okay, a patient care technician is preparing to obtain a 12-lead EKG for a patient who is being evaluated for chest pain
For
in the
chest
emergency.
pain in
Ajá,
emergency
chest
department.
pain. Which of the following actions should the technician take if the patient express fear of the person? Okay, avise the patient.
That is the fear to the
eh,
procedure.
Ese, la
Advice, yes. La
patient care technician is caring for a number of patients following a chief chain. Which of the following patients should the technician assist first? A patient who have a temperature 91, no. A patient who is disoriented, a patient who is comatose, a patient who is incontinent, la persona que te desoriente. Es verdad, una persona que está desorientada. A patient care technician
Yo me
obtain.
iría con un incontinente, like, you know what I mean? Gonna pee, gonna poop.
Pero está incontinente.
Recuerda que tú estás haciendo el papel de nurse,
Ya, pero incontinente no quiere decir,
que se va a cagar y se va a mirar encima.
oh, sí, eso es.
That's
Let
what
me
it
see.
is.
So patient who is incontinent.
Yeah. You cannot hold
Okay.
your pee and your poop.
Okay. A patient care technician shall obtain a sponsor specimen from a patient. The technician should expect the specimen to have which of the following characteristics.
Pero es tricky la pregunta porque una persona con demencia, you have to take care. Pero
Yes.
tú la sientes en un lado, tú la estás vigilando. Pero una
Yeah.
persona que se está cagando encima is going to make a mess.
Yeah. A patient care technician obtain tú no sé qué es eso, specimen from a patient. The technician should expect the specimen have which of the following. Inconsistent water. No sé qué es eso, solo voy a
No
dejar
tengo la
así.
menor idea.
No sé qué es eso.
Tú ves
A
que tantas
patient,
cosas que salen raras.
a patient care technician is obtained a blood specimen for coagulation test. The technician should select a tube that contain which of the following additive. Sodio citra, erythema, no. Que para coagulation. A patient technician obtain a blood specimen for coagulation test. ¿Cuáles son los coagulation? Los EDTA son coagulation.
No. Depende. Bluetooth and the other is coagulation.
Patient care technicians obtain a blood specimen for
Hairpin
coagulation.
tube,
The
they
technician
are
should select the
anticoagulation.
which of the following.
Hairpin, they are
Okay.
coagulation. Heartburn and also latte, they are coagulation too.
Tuvieron, ¿no? Sodio citra
They are both, yeah.
y EDTA
EDTA tan combinado.
también está combinado.
Mhm.
Bueno, lo dejé así porque está combinado solo, ¿no?
Yeah.
A patient care technician is reinforcing teaching which a patient who is using a incentive experiment. Which of the following statements should the technician take?
No
No
sé qué es
entendí.
eso.
A
¿De
patient
cuál?
care technician is
No sé qué es eso.
no sé. Vamos con la otra porque yo no entendí esa. A patient care technician should recognize that healthcare facilities are required by which of the following is essential to keep safety data sheet available. Clear? No.
Yeah.
Clear maybe, yeah.
Yeah.
Clear. Clear. Which of the following blood specimens should a patient care technician keep chilled during transportation laboratory? Bilirubina,
La glucosa es like hold on. The Bluetooth, ¿qué tiene adentro?
yo creo que esa bilirubina.
Yeah.
Ya, yo creo que bilirubina que tiene que estar cosa. La armonía tiene que estar, yo creo que en
Yeah.
el sol, que no puede dar la luz.
En continuo.
Glucosa, I don't know. Y esta es un Johnson taquicardia.
Ya, yo no soy taquicardia.
Yeah. O ventrículo taquicardia.
Es ventrícula, ya. Porque esos son
Ventrículo taquicardia.
ya son ventrículas.
A patient care technician is to perform a venous blood draw of 91 years old patient. The technician should wish of the following method. A butterfly needle and syringe. Yep.
Ya, eso está bien porque suena colapso.
A patient care technician is using messages to
Massage.
massage to stimulate circulation for a patient who is immobile. Which of the following areas should the technician massage? The patient back, the patient lower leg, radial area, bony position,
Bony
¿Ah?
position.
¿Qué bony position?
En la parte de los huesos, esta parte de aquí ahorita.
Oh, a
Con-
patient care technician is transferring a patient from the bed to the wheelchair. In which of the following positions should the technician stand during the transfer? Stand in the patient behind the wheelchair, on the patient with side, with one leg between the patient leg, así mismo,
Ujú.
que está en el medio. A patient care technician should recognize that which of the following scenario require a accepted dressing change. Changing the surgical wound dressing of a patient who is one day prosper, no. Changing a patient strip lump catheter dressing. Changing the dress of patient who have a deep wound draining, no. Changing the dressing of a patient who has sulfica decubicula, I don't know. Maybe for the catheter. A patient care technician is preparing to assist in performing an EKG for a toilet. Which of the following lead can be placed in image to typical explain to prevent cross of the toilet? It's gonna be
Ajá,
elite
espera.
3. Yeah. A patient care technician is preparing to dispose of a dressing that is heavy, solid, in liquid fluid. In which of the following solution should the technician dispose in the dressing? Toilet, no. In behind the bag, moisture, trash, in behind the bag. Moisture resistance. Es verdad, en behind the bag, porque está, o maybe resist, no, yo lo voy a dejar eso porque technician care, patient care technician is preparing to perform passive passive range of motion exercise a patient need. In which of the following type of um external ration extension, addition no es, inversion no es, external reaction, yo creo que esa misma,
Range
extension,
motion
yeah, pero ahí no está range of motion,
of the knee. Yeah, pero está diciendo the knee. Yeah,
yeah, extenso,
extension porque
yeah,
yeah.
yeah, extension. Patient care technician is collecting a patient tuno specimen. ¿Qué tiene eso?
Yeah.
Specimen. Which of the following actions should the technician take? Introduce the patient to performing shallow cut. Oh, esos son catarros quizás. Collect a
Yeah.
minimum of 5 tips of cone. Have a patient to alcohol back monitor. Or take a specimen before 10 in the morning. Yep. Eso es catarro.
Yeah, sí.
A patient care technician is caring for a group of older adults. The technician should recognize that which of the following type of injury pose the greatest risk accident death in this art group. Burn, fall, in,
La
entrapment,
misma.
eh?
Oh, yeah.
Entertainment, no, esa misma fue.
Si quieres,
Patient
cogiste la correcta.
Yeah, patient care technician is preparing to collect and transport a bilirubin blood specimen. The technician should use to which of the following color? Amber. Yo creo que amber. Porque no puedo dar la luz.
No.
No.
Ya, está bien.
A patient care technician obtain is to a specimen from a patient. Which of the following actions should the technician take when labeling the specimen? Apply label to the side of the specimen containing. Apply the label to the leaf of the specimen containing. Apply the label to seal the leaf into the specimen containing. Apply the label on the outside of the seal via a bag that hold the specimen containing. No.
No, apply the,
Apply the label side of the specimen containing. On the
yeah.
side,
Mm-hmm.
uh, a patient care technician assistant which care a patient who is in a street or IO, which often should be the technician record a patient. Creo que cada 2 horas, creo yo.
Yeah, every 2 hours, yeah.
Every 2 hours, ¿verdad?
Mm-hmm.
Yeah. A patient care technician obtain a EKG, a know the presence of weight $1 by baseline, in which of the following attitude the technician not take. Move the patient bed away from the wall. Clean the patient's skin on the electric with alcohol. No. Ask the patient to take a slow deep breath. No. Introduce patient, place the hand palm down on their butt. Yep.
Yeah.
Patient care technician should report which of the following possible elderly abuse or negligence. A patient who refused to take prescription medication, a patient who report receiving phone call from family but never any visited, no, a patient who report his checking account is being uh, management by his daughters, no. A patient who provide has refused to sign paperwork to allow for renew or the patient driver license, no. So patient who refuse to take prescription medication, ¿verdad?
Dice que abuse or negligent.
Patient who report to receive phone call, pero es que no tiene sentido las otras. Patient who report the checking account has begin managed by his daughter, grandchild. A patient whose provider have refused to sign paperwork to allow for renew of other patient driver
Yeah, you
license. No,
see, no hacen sentido ninguna.
no hace, la única que eso puede ser esa. Which of the following findings should a patient care technician report a nurse? 1-year-old patient who have a pulse rating the 50, a 12-year-old patient who have pulse, the 4 years old have pulse. Yo creo que esa misma.
¿Y por qué lo va a reportar? Why we should the following
Porque está alta.
of finding.
O la del niño. No, pero los
Yeah.
niños, los pulsos de los niños son altos.
Exacto.
Yo creo que esa misma, la de 85.
Ujú.
A patient care technician should identify that which of the following action can create sharing for and impair skin integrity. Using a lift device to report a patient, reposition a patient every 2 hours, assisting a patient the bathroom quickly, evaluate the heart. No, ese mismo.
Yeah. Ujú.
Tiene que a patient care technician receive a needle stick injury. The technician should report the injury at which of the following department, which for it, no, before the staff at the next shift, no, by the end of the document, pay, pay payroll, no, before leaving the facility at the end of the shift. Yep.
Yeah, that one.
A patient care patient care technician is transferring a non-weight bearing patient from the bed to the wheelchair. Which of the following should the technician take? Keep the bed at the most for tablet weight high. Place the end of the patient arm to preview support.
La C,
Lock
correcto.
the wheel with the yep.
Bien.
Patient care technician attend and insert about performing CPR on patient. Which when performing CPR, which of the following attitude the technician take? Appear 60 to 80 compression, no. Compression for no. Appear 100 to 20 compression for minute, followed by 4 slow breathe, no.
No,
Apply
la C,
100
yo
to
creo
120
que
compression for minute for about 2 breaths. Esa
yo creo
misma.
que es esa misma.
Yeah, de 100 a 120.
La cogiste sin querer, te diste cuenta.
A patient care technician is preparing to perform a vena punch for a patient using a anticurricular area. In which of the following angles should the technician insert the needle? De 15 a 30.
Yeah.
A patient care technician is preparing to disinfect a contaminated piece of equipment. Which of the following action should the technician take? Screw the equipment with bleach solution, no. Rinse the equipment with warm water, no. Process the equipment in autoclave. Soak equipment
Yo
to
creo
the
que la
cold water.
B.
Rinse equipment with the warm water, no.
Oh, yeah,
Autoclave,
that one, yeah.
yeah. A patient care technician is preparing to open a sterile packet. Which of the following actions should the technician take first? Perform hygiene, remove the seal, place the item in the
Yeah, la
center.
A, perform hygiene.
Yep. Which of the following actions should a patient care technician take when preparing to transfer a patient from bed to the stretcher? ¿Qué es eso, stretcher? Stretcher. Elevate
La
the
cosa de
bed.
la cama.
Oh, elevate the bed to a position equal to the
Yeah, that
height
one.
of the stretcher.
Mhm.
Okay. A patient care technician is assistant with the care of a patient who have activity tuberculosis. Which of the following type of mask should the technician wear when the patient room? N400, yep. De que N400, N95.
Mhm.
A patient care technician is caring for a new patient. The technician should recognize that which of the following procedure requirement medical access or cleaning technique. Assisting to apply sterilized dressing, insecting urina catheter, changing bed line, cleaning a opening room. Patient care technician is caring for a new patient. Oh, yes. New patient. Technician should recognize that which of the following procedure require
No,
medical.
la A. Correcto. Assisting in applying a sterilized dressing, oíste.
Okay. A patient care technician is caring for a patient who have colon cancer. Which of the following findings should the technician expect? Blood stool, weight getting in this a small lean blood stool, baby.
Yeah, no, it's a blood stool, yeah.
Blood stool.
Blood.
A patient care technician is collecting a urine specimen and accidentally spill on the floor. Which of the following action should the technician take to clean the spill? Use a clean dry towel? No. Use disinfectant that contain bleach, coat the
Yeah, that one.
strong material thin, use a pot, yep, tú no lo limpia. A patient care technician should recognize that which of the following statement drain skin preparation for blood culture occur. We clean a area with the 70%, no. I will cleanse the area with the sodium high pressure. No, I will clean the area with the. Esa misma es.
Yeah, esa misma.
And they choose to perform a capillary puncture. It's best determined by which of the following factor: patient weight, patient diagnostic, test result,
Patient
test
way,
order,
patient way. Remember?
patient weight. Yep. A patient care technician is caring for a patient who have a prescription for an antibiotic stocking. No sé qué es eso. Which of the following action should the clinician take? About roading the stroking.
No hay día. Sigue la otra.
No sé lo que es eso. A patient care technician is preparing to perform a vena punch for a patient who speak a different language in okay. Use a term for speaking to antiseptic patient. No. Interpret the patient
La
needle
D, la
and
D.
provide patient with a preference translation. Patient care technician schedule hygienic care measures to be performed at the same time of other care measures. Which of the following things best describe the technique action? Continue of care plan, coordination of care, ¿es verdad? Hygienic care, claro. Hygienic care schedule o coordination of care.
La
¿Cuál tú crees?
pregunta dice cómo es. Hygiene care measurement to perform at the same time another care measurement. Okay, yeah.
Yeah,
Yeah.
coordination, ¿verdad?
Mhm, mhm.
A patient care technician is assisting a nurse to set up substitution equipment for a patient who have a tra stomach. Which of the following attributes the technician take to maintain the stability of the equipment? Place the pacemaker drop on the rotating side. Use the double hand turning the situation machine. Use a clean glove to open
Definitivamente
the.
esa no es la que está seleccionada.
Yeah, yo creo que esa. Use a clean glove to open the suction cataract kit. La única que yo veo como más o menos. So.
Sí, continúas
A,
faltando.
after drawing 6 BF of blood for a patient care clinician find that 2 of the 6 BF are
¿No te
expired.
escucho?
Uh, okay, after drawing 6 BF of blood for a patient care clinician find that 2 of the 6 BF are expired. Which of the following action should the technician take? Notify the manufacturer,
La D, la lámina C.
discharge,
A, B, A, B,
discharge,
A, B, B.
discharge spitting meter, no. Submit the BR for testing.
No, la
La
B.
D, la
Ah,
D.
no, no, la B.
Discharge the
Discard.
specimen BR.
Que lo tíralo, ajá. Porque está vencido, eso es lo que dice, está expired.
Yeah, a patient care technician is a document in patient health record. The technician should identify which of the following abbreviation in on the Joint Commission approved list observed. Yo creo que esta. No, yo creo que esa.
Espérate.
Le doy para atrás.
Sí, un segundo.
Yo creo que
Okay,
esa.
hold on. A patient technician is documenting a patient electric health record. The technician should identify that which of the following abbreviation is the Joint Commission appropriate abbreviation. Oh, ¿tú crees que esa? Ok, fine.
Yo creo que esa, no sé. Vamos
Yeah.
a ver. Which
Porque
of the following,
ese es nothing by mouth. Yeah.
yeah,
Okay. Which of the
which
following?
of the which of the following is a consequence of misleaving a blanket specimen? A hypopulation, a transfusion reaction, a medical transcription error, a
La B.
la B,
Ujú.
tran-
El transfusion
transfusion reaction,
reaction. Reaction. Me recuerda de que le puedo dar un shock, que me pongan la sangre tuya, me den la medicina tuya. A mí,
yeah,
¿te recuerda?
ajá, so
Finalizar.
le doy finish.
Yeah, finished. Y añana con 4 minutos. Ya, bueno, pero
Bueno, pues la hicimos, vamos a ver. Uf, mira la score ahí donde está.
ok,
En
dale
Flavaromi
para
tenemos 78,
dale
un
para
50,
abajo.
un 53, oye. We failed that. Mira. Patient care de 45 sacamos 23, 22 malas, ahí está. Y de complaint safety and professional care de 20, 10. Infection control de 11, 4.
No, pero para mí
Y,
está mucho mal, ¿te diste cuenta?
y de phlebotomy de 11, de 14 fue 11. Y de EKG de 10 fue 5.
O mira, dale para arriba, para yo coger un screenshot de la cosa completa. Ajá, ok, ajá, un segundo,
Ahí.
sí, ahora ya lo cogió. Ana, dale clic ahí a donde dice para ver si te da, no, ahí no, a donde dice los números, aquí mira,
Oye, aquí te
ahí,
dice los cosas. Mira,
exacto,
aquí te dice todas las cosas.
por eso mismo, mira,
Eh,
eso tiene detalle, Ana.
sí, pero no te dice la pregunta, solamente te dice report critical value. ah, Tú sabes, esos fueron todas las 21, las 22 que faltaron. De la 45 a la 22. Tú
Wow,
ves. Ya. Y después de aquí te dice el safety. Aquí está la 9.
chiu.
Ya.
Pero que esa está arriba, está arriba.
Ya, pero entonces aquí hay otra cosa de que mira, begin, aquí te da esto, mira, tú ves.
¿De nuevo? ¿Lo vas a hacer de nuevo?
No, te da otra cosa. Te da informaciones aquí, mira. Aquí te da informaciones de la donde tú estás mal. Mira, todo estos son todas las cosas.
Ok,
Y tú puedes, y estos son como, tú ves, mira, esto es la posición de skincare, tú ves.
esa fue una de las que sacamos mala, ¿no?
Ajá, estas son de las que sacamos malas, tú ves. Te da te da PDS, mira, tú ves, para que tú lo leas y lo entiendas.
It's really cool.
Tú ves, míralo ahí, ese coso de cuando lo limpia, tú ves.
Yeah, pero no nos dio
Ya.
la respuesta. Bueno, ahí tiene que estar la respuesta.
Sí, pues tiene que tener el otro examen, ¿oíste?
Sí, bueno, I think I'm gonna get the EKG then para yo poder hacer eso.
Yes, tú estás viendo la información que está dando esto, solamente este.
Tuve, pero que toda esa cosa ella no nos dio todo eso.
Esas son todas las cosas y tú la puedes bajar y poner un folder de eso.
Ok, entonces déjame parar la grabación.
O sea, que aquí.